Welcome to The Explainer. Today, we're digging into a really fascinating academic paper that tackles a huge question pretty much every country has to face. When you change how you pay for healthcare, how do you make sure you don't accidentally make the whole system less fair?
Okay, so here's how we're going to break it down. We'll start with the challenge Malaysia was up against with its healthcare funding. Then, we'll look at the new insurance plan they cooked up. After that, we'll see how researchers actually measured its fairness, check out a much better model they designed, and then, wrap it all up with the final verdict.
All right, first things first, let's set the stage. To really get why this new plan was such a big deal, you have to understand the problem Malaysia's really excellent healthcare system was facing.
And this is the core dilemma, isn't it? Malaysia, like a lot of countries, has high-quality healthcare for everyone. But the costs for that care just keep climbing. New tech, aging populations, you name it. So the question isn't just, hey, where do we find more money? It's, how do we get that money in a way that's actually fair to everybody? You see, for years, Malaysia pulled off this amazing balancing act, a top-notch system that only cost about 3 to 4% of their entire economy. But everyone knew that couldn't last forever. They were going to need a new, reliable source of cash to keep the system strong for the future.
So with that big challenge looming, the government came forward with a pretty bold new idea for bringing more money into the system.
The big idea was to create what's called a National Health Insurance System, or NHI. So instead of just relying on general taxes, this would create a dedicated pot of money just for healthcare. The thinking was, it would create a sense of shared responsibility where everyone who can contributes directly.
And how would it work? Well, it was actually pretty simple. The plan called for a single, flat contribution rate. Everybody pays 5% of their salary, and it goes right into this new health fund. Simple, clean, easy. But was it fair? Now, on the surface, the intention here was absolutely fantastic. The whole policy was built on this very noble idea that folks with a greater ability to pay should help cover the cost for those with less. A great goal, for sure. But the real question is, did the way they designed the policy actually get them there? Okay, so this is where it gets really interesting. Researchers decided to put this whole plan under a microscope and actually crunch the numbers to see if this 5% flat rate idea was as fair as it was meant to be. To do that, they used this really clever tool from economics called the Kakwani Progressivity Index. The easiest way to think about it is it's a fairness score. If the score is positive, it means the system is progressive, which is a good thing. It means wealthier people are paying a proportionally bigger slice of their income than poorer people. The higher the score, the fairer the system. So first, they needed a starting point, right? A baseline. They calculated the Kakwani score for the system they already had, which was mostly funded by taxes. And look at that. The score was a positive 0.217. That tells us the system was already pretty progressive and pretty fair. But then, they ran the numbers for the new 5% flat rate plan, and whoa, the fairness score took a nosedive. It dropped all the way from 0.217 down to 0.168.
And this chart just lays it all out crystal clear. You can just see that drop from the current system to the proposed one. So despite its really admirable goal, the new plan would have actually made the entire healthcare funding system less fair than it already was. So you're probably asking, why? How could a plan with good intentions make things less fair? Well, it's because the new insurance plan was taking money that used to come from very progressive income taxes, where high earners paid a much higher rate, and replacing it with a flat rate contribution. When everyone pays the same percentage, it actually puts a much heavier burden on people with lower incomes. But here's the best part. The researchers didn't just point out the problem and walk away. No, they used their data to build a model for a much, much better alternative. They thought, okay, what if we scrap the whole one-size-fits-all idea? What if we designed an insurance system that was progressive from the ground up? A system where the rate you pay actually changes based on how much you earn. And this table shows you exactly what they came up with. It's a tiered system, see? People in the lowest income bracket would only contribute 3%. Then the rate climbs for higher earners all the way up to 9% for the folks at the very top. It basically builds fairness right into the DNA of the plan. Now here is the kicker. This much, much fairer system, it was designed to raise the exact same amount of total money as the government's original 5% flat rate plan. It proved you don't have to choose between raising money and being fair. You can absolutely do both. So this chart tells the whole story in one picture. On the left, you've got the original system's high fairness score. In the middle, that's the big drop caused by the flat rate plan. And then on the right, look at that.
The progressive plan brings the fairness score almost all the way back up while still hitting that all-important funding target.
Okay, so let's zoom out. After all that number crunching and modeling, what's the big lesson we can take away from this deep dive into Malaysian health policy?
Well, it really shows that the design of a policy is every bit as important as its goal. You can have the best intentions in the world, but a simple one-size-fits-all approach can backfire. A progressive structure, one that understands people have different abilities to pay, is just fairer. And really, this whole study shows the power of using data not just to find problems, but to actually build better, smarter solutions from the get-go.
I mean, the authors themselves summed it up perfectly. They said a progressive insurance scheme could be implemented to raise the money needed for health funding while preserving the fairness of the whole system. You can have your cake and eat it too if you design it right.
And that really leaves us with one final big question to chew on. This whole case study is a powerful reminder that any policy change, whether it's in healthcare or education or taxes, isn't just about the money. It's about making a choice about the kind of society we all want to live in. Thank you for watching The Explainer.